Hey, my name is Shannon Miano, and I am going to talk to you about conflict, delegation, and creating a healthy workplace in nursing. A situation where I had to deal with a conflict was with a patient refusing vitals. However, the patient was demanding food and pain medication. The primary nurse requested assistance from me with this conflict. So conflicts don't always have to be between employees necessarily. Sometimes it can be issues with patients or even possibly family members. Um, the way that I resolved this, I did have to use some conflict management techniques. So I'm going to go over all of the techniques first. Different ways to manage conflicts are compromising, which is where each party gives up something. Sometimes that can be a lose-lose situation. Sometimes it can be a win-win situation. One of the parties has to feel like they gained something in order to compromise. So um, sometimes it can be a good thing and sometimes it can be a bad thing. Competing is when only one party gets what they want. So you're just trying to get whatever you want, regardless of what the other person wants, because you want to win. So that's usually builds up into more issues later on. Cooperating and accommodating is the opposite of competing. It's when somebody just decides, okay, you can just have what you want, and they accept the loss. Smoothing is where you focus on what you agree on and not what you disagree on, so it doesn't actually resolve the problem at all. You just kind of smooth it over and try to make everything seem like it's okay. Avoiding is ignoring the conflict. So that would be like in the case with my conflict with the patient refusing vitals and wanting to do whatever he wants. That would just be if I went in there and said, okay, everything's fine. We'll give you your pain medicine and uh, I'm just going to give you another nurse and avoid the actual issue with the patient. Collaborating is setting aside your original goals so that you can reach another goal that is mutually agreed on. So that is the ideal conflict management, is to collaborate and work on what works for all parties, and collaborating builds a better environment. That's the only one that's considered a win-win. So in my situation, I compromised with the patient. So it's a little different than what you would maybe handle with your employee. You have a long lasting relationship with your employee. You never want to upset the patients, but in this situation, I had the RN in there and we agreed to give the patient pain medication if they allowed for their vitals to be taken. So in this case, they kind of both give up something. Not everyone wins. You know, the nurse didn't want to give the patient any pain medication and still wanted to take his vitals, but that was more out of spite. So we worked it out because obviously it's unsafe to administer pain medication without vitals. And ultimately, even though I don't think either parties were very happy about it, they understood and they were able to comply, and it prevented the patient from taking out the issue on other nurses. So if both parties feel like they got the better deal, then it resolves the conflict. So later on, the nurse was telling other nurses, you know, I told him I wouldn't give him his pain medicine, and I called the charge nurse, and ultimately they both got what they really wanted. So the patient was safe and everything worked out. So whenever you negotiate, there are different things to keep in mind. So before you even negotiate, you want to systematically prepare. So you want to know as much as you can know about the negotiation itself. You want to gather information and be ready to negotiate and know your bottom line, but not necessarily throw it out there as soon as you start. And then you want to consider somebody's hidden agenda. So why are they wanting to negotiate? What side will they take? And what is their reasoning that maybe they're not very upfront about? During the negotiation, you want to stay calm. You always want to listen. They say you should listen 70% of the time and only talk 30% of the time. And assertiveness, that relates to you not letting someone just walk all over you. You have to mean what you say and back up what you think and be prepared ahead of time so that you're not stumbling for words. And after, you want to review the terms and accept the decisions. So once you do reach an agreement, you want to make sure that you both fully understand what you're agreeing to. If you do start to get angry or upset, it's very important to take breaks, and that will ultimately lead to a better result than both parties being heated and upset. Destructive techniques during negotiation would be ridicule when you're intimidating others and getting your way just because you're being mean and you're bullying somebody. Ambiguous or inappropriate questioning. So that has happened to me several times, where you're trying to get to the bottom of an issue and the person you're talking to is trying to talk about something else that is completely unrelated. And sometimes people do that if they don't have enough information on the subject to distract from the fact that they don't have good answers for what you're talking to them about, and they don't have good reasons for their side of the negotiation, and they just want you to leave them alone. And then sadness, that's destructive. That's when people, that brings out empathy or having someone feel bad for you so that they cater to you, and that can be potentially destructive for both parties. So it's important for employers and any nurses in any conflict to look out for. Delegation. Delegation is where you give a task that you could perform to somebody else that can also perform it, and it's good for time management, and it's necessary in nursing. An instance where I delegated was having a CNA check these blood glucose readings every 2 hours, on all of the odd hours, on Mr. J, so that we're not violating HIPAA. So rights of delegation include the right task. Make sure that it is appropriate for the patient. It's what is supposed to be done. Make sure that it's the right circumstances, so it's the right setting, you have the right resources, you have everything required for the AccuChecks. And then the right person, make sure that person has been checked off on using a glucometer, knows how to use it, they understand what's going on with the patient and the patient themselves. You want to give them the right direction and communication. So you want to make sure that you're explaining exactly what you want from them and at exactly what times, and giving them a reasoning why helps. It's not necessarily something that you have to do, but if they understand why they're doing it, then, and they understand, what the blood glucose should be, and they're taking it and they're seeing that it's 400, then they will understand why you're taking it every 2 hours. And then the right level of supervision. So you don't just tell somebody to do something every 2 hours and you don't check to make sure it's being done. So you want to check to make sure it's being docked, that it's registering into the computer, that you're getting appropriate numbers, that you see them do it, and make sure that it's adequate, and that it's not possibly giving any false readings because their finger is still wet or because they're not wiping off the first drop of blood, and that they're going by the correct procedure. And then also afterwards, giving them good evaluation and feedback, telling them, you did a good job. Thank you so much. Tell them how much it helped you. They can see other things that you're doing so that they feel like they were a part of the situation and that they ultimately helped you. Rights of delegation. So that was addressed with my situation because the every 2 hour glucose was appropriate. It wasn't just for fun. There's a reason that the doctor wanted that done. The CNA did know the patient. They had been caring for them. It was the right situation for that person to be doing it. It was the right patient. It was the right nursing assistant, and it was the right person delegating because it was the primary nurse of the patient. Communication was good because I explained exactly what times they needed to be checked, and I communicated that if for some reason she was unable to do it, that I would need to know so that I could perform it. And then I did make sure that she checked the glucose at the right time and that they populated in the system. So successful delegation strategies include identifying the necessary skills and education, planning ahead, select and encourage employees. So ahead of time, getting a feel for how your employees feel about doing certain things and how much of a go-getter they are versus how shy they are. You want to communicate effectively, which I definitely feel like we did in that situation. Empower the delegates, which we also did in that situation because we told them how much it helped us and that they were capable and that it made a big difference to us. Setting deadlines, monitor progress. So, like I said, we were checking to make sure it was going in. Monitoring the roles and evaluating them, which we also did. And then rewarding for successful completion of tasks. I did write a kudos type of thing to that person so that they realized how much of a difference that made because she already had other tasks on top of that. It was a lot to load on her, but it was a big situation that a lot of people were involved in, so we appreciated her going above and beyond and getting things done and helping the patient. There's a lot of delegation errors that we see all the time. So under delegating is delegating very little. So sometimes people do that because they don't want others to have the idea that they cannot do it, or because they don't trust other employees to do what they need to get done for their patient. So being in ICU, I see that all the time. Nurses want to do what they want to do for their patient, and they overwhelm themselves. And that leads to burnout for that nurse. They can't do as much as they would do if they could delegate more tasks. Over delegating is when you delegate too much. You have poor time management, so you have to put tasks on other people that you should be able to get done on your own. Sometimes it's an insecurity, like you don't know how well that you'll do it, so you're asking someone else to do it for you. And ultimately, this burdens the staff that you're putting these responsibilities on. And then improper delegating, we also see commonly where you're asking your CNA to restart your IVs, or you are telling them that the patient needs to be changed, but you're not telling them that their whole entire bed is dripping and things like that. You want to give good communication for what the person you're delegating to should expect. And you also need to make sure that it's proper timing. You shouldn't be giving the same person who's has to bathe 5 people the job of going around and restocking the carts right now because nobody has gowns and syringes and that type of thing. Creating a healthy work environment. So the definition by the American Association of Critical Care Nurses is having a fulfilling workplace with positive patient outcomes. So that means typically that employees are happy, they like where they work, you do not have a high turnover, and your patients do really well. Components of a healthy work environment include skilled communication, where you communicate with your employees, true collaboration, where you take everyone's ideas and you make things better for the unit by seeing what problems there are and working on resolutions that serve both the patient and the employees. Effective decision making, where even though you involve your staff, you look at the bigger picture on what's possible and what makes the most sense for your unit. Appropriate staffing is always a big thing in nursing. Nurses always feel like they're not appropriately staffed. I personally, in my ICU, feel like we are appropriately staffed, and that's been working out good in the COVID situation. Meaningful recognition, where you feel like your leader actually appreciates you and that people would actually feel upset if you left. So feeling like you matter is a big deal. And then authentic leadership, where I take this as, your leaders are transparent, you know what to expect from them. They don't change their mind from day to day. They are solid in their beliefs, and they always work to make the unit better for the staff members and for the patients. I touched on this a little bit, but my current work environment, I think, is healthy overall. We have really great leaders. We have really experienced assistant nurse managers. There's very good communication. We get communication every day, especially during this COVID process. We always have updates and we always know what's going on. I feel appreciated because I've only been there for a few months and they're constantly thanking me for adapting and for being positive and for picking up days to help the unit. And then true collaboration, which that's the only thing that I think that we could work on, but that's affected by the COVID pandemic. We are doing what we're being told to do because nobody's experienced a pandemic before, and it's not all about what we all think we should do. It's about what materials that we have and what's possible and what is manageable. And then knowledgeable leaders, like I said, I have very good leaders that have been in management for a long time that have worked